Hi, do you suffer with back pain? Well, if so, listen in. Lower back pain is one of the most common presenting factors in general practice, and most typically, the most common cause is mechanical lower back pain, which is generally muscular, often brought on by lifting things that are a bit too heavy. That's the most common problem. Now, we know it's primarily muscular when it's across the lower back, the lumbar area, but mainly in the sort of muscles either side of the spine that can be sore to touch, certainly sort of sharp pains when you move. There's no major radiation or movement of the pain down the legs. It's all mainly in the back, and it's fairly recent onset, and it's often associated with some heavy lifting. That is mechanical or muscular back pain, and that can simply be managed by just being mobile, avoiding heavy lifting, and using simple pain relief. If you have pain directly over your lumbar spine, so right in the middle, over your bony spine, right at the bottom, if there's pain directly over there, then that's definitely worth, as with all situations, highlighting with your GP. Sometimes, if there is a sudden onset of severe pain over the central sort of vertebrae over the lumbar spine, that might require some imaging potentially. So it's worth discussing with your doctor about whether an X-ray is required. Obviously, people that are in the older age bracket, perhaps with thinner bones, there's always the risk of a vertebral fracture where bones can thin so much that they actually crack and collapse. That can cause pain directly over the lumbar spine. There are lots of other causes as well, but certainly if you have pain directly over your spine, it's worth chatting to your GP and looking at getting some imaging done. Now, sometimes with mechanical back pain, it can radiate into the buttock and down as far as the knee, and that can be quite common. That can overlap sometimes with pain from osteoarthritis of the hip. But if you're getting sharp shooting pain radiating down the back of one or both legs and down the outside of the calves and into the side of the foot, then this could be a sign of sciatica, which is nerve compression at the lower spine. But the way that we're wired up, the wires run right down our legs, down the outside of our calves and into the outside of our feet. That's significant, and that definitely warrants a GP review. And if those symptoms are persistent for over 6 weeks, sometimes we need an MRI scan just to check. Often the most common cause behind that is a herniated or slipped intervertebral disc. So the back is made up of bony vertebrae, and in between each bone there are sort of jelly shock absorbers, which are like fibrous rings which have jelly material inside. And these discs can sometimes rupture out or slip or herniate, and they can press on the nerves which spring from either side of the spine and innervate our arms and legs. So we're down in the lower spine, the nerves mainly run down the legs. And so if that happens, if you have a sudden onset back pain with a sharp shooting pain or numbness going down the leg or one or both legs, then that's a sign potentially of sciatica and needs some imaging. One of the warning signs for that is if you have something called cauda equina syndrome, which is when the nerves in the sacrum, that's the tailbone, are crushed or damaged. That can cause numbness or tingling in and around the genital area and the perianal area. That is really significant and often would warrant an emergency ambulance and emergency scanning. So, hope that's been a rough guide from back pain, the most common causes, the very simple muscular mechanical back pain, right through to the more significant sciatica onwards. And yeah, but any doubts, as always, if you are having trouble with back pain, please consult your doctor. Until next time, thanks for listening.